It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I shared with you how to control your positive self-image whilst your loved one is critically ill in intensive care. You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to teach you how to stop being held hostage by the intensive care team if your loved one is critically ill in intensive care. If your loved one is critically ill in intensive care, and if your loved one is facing one of those challenging, difficult and heartbreaking situations where your loved one is either very unstable and in a very critical condition, or is in a life-threatening situation, or is in intensive care for long-term treatments and long-term stays, or your loved one may be having a severe or traumatic head or brain injury. They may even be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order. Or your loved one may be in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being, quote unquote, in the best interest of your critically ill loved one. Or your loved one may even be approaching their end of life in intensive care. In those situations, the tension tends to be extremely high. The tension in those situations generally is palpable, and more often than not, families of critically ill patients in intensive care in those situations feel like they are held hostage in a situation that they wish they'd rather never encountered in the first place. But let's face it, given that you are here, you are most likely in this once-in-a-lifetime situation. More often than not, families of critically ill patients in intensive care feel like they are held hostage by the intensive care team, because after all, the intensive care team is calling the shots, so to speak. The intensive care team is driving the bus, and the intensive care team, with their positioning as the perceived power and the perceived authority, is more or less driving their agenda in those situations. If families of critically ill patients in intensive care don't feel like they are held hostage by the intensive care team, then they certainly haven't fully embraced what they are dealing with. They haven't fully embraced what is at stake, and they haven't fully embraced that there are too many wheels in motion behind the scenes in intensive care that impacts on how the intensive care team positions your critically ill loved one's diagnosis and prognosis. Let's look at a real-world example so that you can really understand what I'm talking about. Now, let's say that your critically ill loved one has been admitted to intensive care after they had a cardiac arrest, while they were playing golf, or while they were out shopping. Let's say your critically ill loved one is 75 years of age and generally speaking has been enjoying a good quality of life until now. Your critically ill loved one has been placed on a ventilator and in an induced coma for at least the next 24 to 48 hours to minimize body functions and to therefore increase and maximize chances of recovery. When your critically ill loved one's heart stopped, thankfully some bystanders commenced CPR, which is cardiopulmonary resuscitation, immediately, but nobody really knows how effective this CPR was until the ambulance with the paramedics arrived. The paramedics continued CPR at the scene, and they also found that your critically ill loved one had no heart rhythm when they first arrived after about 10 to 15 minutes after the alarm was raised. After continuing CPR, the paramedics eventually got your critically ill loved one's heart rhythm back, and they then transferred your loved one to the intensive care unit. After you received the unexpected phone call from the intensive care unit, you and your other family members rush to the hospital to see your critically ill loved one in the induced coma. You and your family feel extremely stressed, overwhelmed, frightened, scared, vulnerable, and worst of all, you feel a loss of control. A few hours into the ordeal, the intensive care team wants to meet with you and your family are now sitting in the intensive care meeting room with a senior doctor, a junior doctor, and the bedside nurse being present in the meeting. The most senior intensive care doctor opens the meeting by summarizing that your critically ill loved one has had a major heart attack. This has been confirmed in various tests, including ECGs, blood tests, and ultrasound. Your critically ill loved one is currently too unstable to have an angiogram, to have an even closer look at the heart, to find out what exactly may have caused the cardiac arrest. The most senior consultant in the meeting also highlights that the prolonged CPR given by bystanders may not have been effective and that therefore brain damage cannot be ruled out because of lack of oxygen supply to the brain. Overall, the most senior doctor in the room is painting a doom and gloom and rather negative picture of the situation that your critically ill loved one is in. He also mentions that further testing may be done. However, he's also mentioning that your critically ill loved one is quote-unquote quite old, and that it's most likely that your loved one wouldn't have any quality of life to go back to after such a massive event. He also goes on to say that further testing may not be quote-unquote in the best interest of your critically ill loved one, as he once again highlights his opinion that your critically ill loved one is quote-unquote quite old and most likely wouldn't enjoy the quality of life they had before the cardiac arrest. The most senior doctor then asks you and your family whether you are understanding the situation and whether you have any questions. In the meantime, you and your family are sobbing uncontrollably. A few hours ago, you, your family, and your critically ill loved one enjoyed life, and now the situation has changed dramatically without any warning. You feel like the world is tumbling down on you. You also feel like you have been presented with cold, hard facts without you actually having the opportunity to have your say. So let's zoom out of this fictional conversation and let's take a breather for a minute. What has happened? Your critically ill loved one is in intensive care after cardiac arrest. They are very sick and their fate and destiny at this point is unknown. The intensive care team has been framing your critically ill loved one's situation as very negative, and they have been painting a doom and gloom scenario. They have positioned your critically ill loved one's diagnosis and prognosis in a way that sets low expectations. The intensive care team has positioned themselves so that anything from now on may appear as a benefit, and most importantly, they have positioned your critically ill loved one's diagnosis and prognosis in a light that will support the intensive care team's mainly hidden agenda. This mainly hidden agenda of the intensive care team when it comes to critically ill patients in intensive care, either being very unstable and in a very critical condition, or in a life-threatening situation, or in intensive care for long-term treatments and long-term stays, or they may be having a severe or traumatic head or brain injury, or even worse, they may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order. Or a critically ill patient might be in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being quote-unquote in the best interest of your critically ill loved one. Or a critically ill patient might even be approaching their end of life in intensive care. Generally speaking, in those situations, the intensive care team only has the interest to support their agenda, irrespective of the challenges, difficulties and heartbreak you, your family and your critically ill loved one are facing. The intensive care team will always protect their own turf first and foremost, and that means that the intensive care team will look at their financial and monetary interests if and when treating your critically ill loved one. They will also be looking at the bed situation in intensive care. For example, are they under pressure to admit other critically ill patients into scarce, expensive and precious intensive care beds? The intensive care team will also be looking at their medical research interests. For example, will treating your critically ill loved one to the best of their abilities support their medical research interests and therefore generate multi-million-dollar per year funding, or is it in the intensive care team's interest to shrewdly and adeptly quote-unquote sell you on a withdrawal of treatment as being quote-unquote in the best interest of your critically ill loved one, because continuing treatment on your critically ill loved one doesn't support their medical research interests? Also, the intensive care team will always look at the politics, the dynamics, the competing interests, the power play and power struggles, the intrigue, the hierarchy and the psychology in intensive care. The intensive care team also always looks at resources allocated to other critically ill patients and whether there are enough resources to give your critically ill loved one the best care and treatment possible. Therefore, if you and your family are unaware of the dynamics, the psychology, the competing interests, the intrigue, the power play and power struggles, the dynamics, and most of all, what's happening behind the scenes in intensive care, the intensive care team will literally hold you and your family and your critically ill loved one hostage. The minute you and your family know and understand that what's happening behind the scenes in intensive care is way more powerful than anything else that is happening in intensive care, that's the minute when you will separate yourself from the 99% of families of critically ill patients in intensive care who have no peace of mind, no control, no power and no influence. The minute you and your family understand that you need to take full responsibility for the outcomes you are going to get when your loved one is critically ill in intensive care, and the minute you understand that it's not what's happening to you and your family, but that it's how you react to what's happening to you, to your family and to your critically ill loved one, that's the minute when you will have peace of mind, control, power and influence. So, how can you do that? And how can you quickly get peace of mind, control, power and influence whilst your loved one is critically ill in intensive care? And how can you stop being held hostage by the intensive care team? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, You learn how to speak the secret intensive care language, so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care. And it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, where we answer your questions, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.